This is NNI Bites Big Learnings, a podcast where fellow healthcare professionals converse about the latest on nutrition science. Join us as Flavia Indrio and Francesco De Seta share their knowledge and insights on intestinal microbiota during preconception and pregnancy.
Hello and welcome to today's special episode of the Nestlé Nutrition Institute podcast, NNI Bites Big Learnings. I'm your host for today. I'm Flavia Indrio. I'm professor of pediatric at University of Salento in Italy. My main research are focused on probiotics, prebiotics, gastrointestinal disease, and nutrition in children. Today we will be discussing intestinal microbiota during the preconception and pregnancy and the impact of this colonization on future health, because recently, as maybe all of you know, the concept of the first 1,000 days is starting to take more and more importance, especially during the pregnancy. Today we have a special guest, Francesco De Seta. Let's get started. Please, Francesco, introduce yourself. We know you are professor of gynecology and obstetrician in San Raffaele University in Milan, but tell us more about you and your specialization.
Hi, Flavia. It's very pleasure to be here with you today. Yeah, I'm an OBGYN, and my main field of interest is microbiome studies in women during pregnancy, after pregnancy, during postmenopausal age. And my focus is the healthy women during pregnancy related to microbiota and long-term offspring.
Okay, so let's start with the question. So, Francesco, what are the critical maternal factors during preconception and pregnancy that influence the gut microbiome diversity and health of an infant? I don't know, maybe maternal age, diet, nutritional status. Please tell us more.
Yeah, the maternal gut microbiome undergoes significant changes during pregnancy. They are influenced by various factors, including maternal age, diet, nutritional status, medical condition, antibiotic exposure. We know, for example, maternal age is really important because during the age, we have a sort of microbial imbalance. It is associated with a high risk of gestational diabetes, obesity, preeclampsia, and other digestive and autoimmune disorder. Diet, for example, is really vital in regulating maternal gut microbiome before and during pregnancy. For example, increasing the intake of fat, animal protein can alter diversity and composition of maternal gut microbiome. Maternal obesity and undernutrition during pregnancy are associated with decreased gut microbial diversity and shift in microbial abundance. At the end, we have several medical conditions like also gestational diabetes, preeclampsia, and they can lead to changes in the maternal gut microbiome. Antibiotic exposure, for example, during pregnancy can increase diversity, alpha diversity, can alter maternal gut microbiome. This can lead changes in metabolic activity, increase the levels of glucose and insulin, and impact fetal growth and development. And also other drugs like, for example, antidepressant. All these maternal factors are really important to shape infant gut microbiome through the vertical transmission. In conclusion, maternal gut microbiome is a critical factor in shaping the infant gut microbiome and overall health. Understanding the impact of maternal age, diet, nutritional status, medical condition, and antibiotic exposure on maternal gut microbiome can help develop targeted interventions to optimize infant gut microbiome development and long-term health outcomes.
Thank you so much, Francesco. Just let's talk about lately. We heard so many times this story of the windows of opportunity to promote healthy microbiota diversity in the offspring infant. But exactly, when are these windows of opportunity? Exactly, timingly, I mean.
Promoting healthy microbiota diversity in offspring infants involves several key windows of opportunity from preconception through the early childhood. During preconception and pregnancy, we know, for example, that the health and diet of mother before conception can influence microbiota. Diet is really important, rich diet in fiber, fruits, vegetables, and fermented foods. Mode of delivery, birth process. We know, for example, that babies born vaginally are exposed to mother vaginal and gut microbiota, which can help establish their initial microbiota. Instead, babies born via C-section miss out on exposure to vaginal microbiota, but exposure to the mother's skin and breastfeeding can help mitigate this. Another important period is the postpartum period. We know, for example, that breastfeeding is really important. First milk, colostrum, is rich in antibodies, beneficial microbes, and this can seed the infant's microbiota. Breast milk contains oligosaccharides, and probiotics, for example, they promote microbiota diversity and health. We know also that we have to impact in early infants from 0 to 6 months, in early childhood from 1 year to 3 years, with dietary diversification, introduction of solid food, balanced diet. In general, recommendation could be stress the concept that maintaining good hygiene, avoiding overuse of antibacterial products can help support healthy microbiota. Allowing children to play outdoor, interact with pets can increase exposure to diverse microbes. And the whole family diet lifestyle choices can influence the home environment microbial exposure, affecting the child's microbiota development. We need to focus this on these windows to this opportunity to modulate in good manner in microbiota.
Thank you so much, Francesco. So we have actually long-term effects on gut dysbiosis on the growth and health of infants. But what are these long-term effects? Can we identify it?
Yeah, gut dysbiosis can have several long-term effects on the growth and health of infants. This effect can extend in the childhood and even in adulthood. There are some potential long-term impacts. Dysbiosis can affect gut's ability to absorb nutrients, potentially leading to malnutrition, stunted growth, and developmental delay. An imbalanced microbiota can impair development of a robust immune system, making the infant more susceptible to infection, illnesses, and has been linked to an increased risk of obesity due to the influence on metabolism and energy balance. We know, for example, that dysbiosis can increase the risk to developing type 2 diabetes, atopic disease such as asthma, eczema, food allergies, inflammatory bowel disease. This emerging research suggests a potential link also between gut dysbiosis and several neurodevelopment outcomes in terms of autism spectrum disorder, in terms of cognitive development, potentially leading to learning disabilities and behavioral issues. Probably to mitigate this long-term effect of gut dysbiosis, we need to encourage practice to promote healthy gut microbiota, such as breastfeeding, balanced diet rich in fiber, limited use of antibiotics, and again, consider also the use of prebiotics, probiotics, to support gut health.
Yes, thank you, Francesco. And this also introduced my next question. You talk about supplementation of probiotics, but focusing on probiotics, which health outcomes can be positively influenced by the alteration in microbes throughout this probiotic supplementation? There are some certain probiotics that can be consumed during specific stages of motherhood, during pregnancy, during lactation, and which kind of influence positively they exert.
You know, the alteration of microbiome through the consumption of probiotics can positively influence a range of health outcomes. There are some key health benefits and specific probiotics recommended during different stages of motherhood, such as pregnancy and lactation. We could reduce symptoms of EBS, including bloating, gas, abdominal pain. We could promote, enhance immune function, and reduce the risk of respiratory gastrointestinal infections. We could reduce the risk of eczema, atopic dermatitis in infants when administered during pregnancy and early life. we could help manage blood sugar levels and reduce the risk of gestational diabetes. We could improve mood, reduce anxiety, potentially benefiting maternal mental health during and after pregnancy. And maybe we could also to modulate body weight and prevent obesity in both the mother and in their children. This is important. Probiotic supplementation is really important to maintain this balanced gut microbiota.
Yes, thank you so much, Francesco. But remaining and talking about, again, this consumption of probiotics during pregnancy and during motherhood, I mean, also during lactation, do this benefit will go also to the breastfed baby?
Yes, mother can consume certain probiotics benefit for the breastfed babies. We have some probiotics are beneficial for both mother and breastfeed. They could support digestive health, reduce the risk of gastrointestinal and respiratory infection, and can influence also the composition of breast milk, increasing the levels of beneficial bacteria and immunomodulatory compounds. And in addition to supplement, mother include probiotic-rich food in their diet, like also yogurt, kefir, sauerkraut, kimchi, and other. It's really important to consume specific probiotic strain during pregnancy and lactation could positively influence mother health and baby health, and also breastfeeding babies.
Thank you so much, Francesco. Lately also we heard these new terms about is estrogen gut microbiome access and this impact on health. Which advice you will give to a woman that is planning to have a baby? I mean, even before the conception period. Would you like to maintain a healthy microbiome? Would you tell to the mother, please keep in mind your microbiome have to be safe even before you are pregnant?
Yeah, this regarding the estrogen gut microbiome axis, this is a really new concept. The estrogen gut microbiome axis refers a sort of bidirectional relationship between estrogen levels and the composition of a gut microbiome. This relationship has significant implication for women's health, particularly in areas such as hormonal regulation, metabolism, immune function, and reproductive health. Certain gut bacteria, collectively known as estrobolome, can metabolize estrogen, influencing their levels in the body. These bacteria produce enzyme beta-glucuronidase able to reactivate estrogens that have been processed by the liver, allowing them to be reabsorbed in the bloodstream. An imbalance in the gut microbiota can disrupt estrogen metabolism, potentially leading to hormonal imbalances that affect menstrual cycle, fertility, and pregnancy. Estrogen can influence the composition and function of the gut microbiota. For example, high estrogen levels can promote the growth of beneficial bacteria that support gut health. We have few advices for maintaining healthy microbiome. Balanced diet with rich food. Consider probiotic supplement with specific strain to support gut health and estrogen metabolism like lactobacilli and bifidobacteria species. Use antibiotics only when necessary. They can disrupt gut microbiota. Avoid excessive use of antibacterial products. A limited intake of processed foods, artificial sweeteners, and high sugar foods. Lifestyle is really important. Engage regular physical activity, which can positively influence gut microbiota composition. Practice stress reducing techniques such as meditation, yoga. Drink plenty of water to support digestion and the health of gut microbiota. Take right amount of vitamin to ensure you and your baby are getting essential nutrients. And remember, we need to focus not from the conception and during pregnancy. We need to focus our attention and we take care of our women at least 3 months before conception. By focusing on these aspects, a woman planning to have a baby can maintain healthy microbiome, which is essential for her hormonal balance, fertility, pregnancy and the health of her future baby.
Thank you, Francesco. Thank you also for shedding the light in this new world we are facing, the world of preconception, the world of conception, and how it's important to consider the microbiome of the mother, not only of a pregnant mother, but also a mother who wants to be pregnant. So microbiome still is underlying to be a very important topic and very important focusing where pediatrician, the doctor, gynecologist have to take attention. So thank you very much, and hope that question will help our listening. Thank you so much, Francesco.
Bye, thank you.
And that concludes today's episode. Thank you for joining us with Flavia Indrio and Francesco De Seta as we talked about intestinal microbiota during preconception and pregnancy. We hope you enjoyed and learned from this quick discussion, fellow experts. Till the next episode.